Obviously the outbreak started in China, and so in some ways, China is sort of a predictor maybe of certain things that might happen in other parts of the world. Have there been particular kind of mental health challenges or patterns that you've been seeing in China as people deal either with coronavirus specifically or with just the impacts of being locked down and quarantined?
Yeah, I mean, there's some initial data now coming out, right? Like we have to understand that yeah, you're right. China was in quarantine and in various stages of lockdown for a lot longer than other places, right? Since early February, to one extent or the other. Actually, Wuhan was locked down before that. So, in mid-January. So, to one extent or the other, and the Wuhan lockdown was just lifted a few weeks ago, right? It wasn't. It was only very recently that lockdown was lifted, and it's still lifting, right, in stages. So, in some ways, China can be a predictor, like we're sort of a couple months ahead of the process, but China's a very different place than much of the rest of the world, right? So we have to acknowledge that too, and we can talk more about that. But in terms of like what we're seeing in terms of mental health needs, there's been some initial studies coming out of Wuhan and Hubei province, especially among kids, that shows an increase in depressive symptoms, right, among children. One study showed that there was almost 30% of children who responded to the survey indicated depressive symptoms, meeting the criteria of a depressive disorder. So that's significant. But this study is super interesting. This study also pointed out that there were things that protected kids, right? So the big question is, how do kids who go through the same situation, right, respond differently? Why do some get depression and some don't? That's a $100,000 question, right? And this study started to point out that children with a certain mindset, children who viewed this pandemic as something that they could overcome, or that we, however you define we, right, could overcome, were protected from depressive symptoms. And we see this pattern a lot in mental health. We see this with stress, right? For example, stress response was a very famous study that was released a few years ago that showed that people who believed stress was bad for you were several times more likely to die, not just get sick, not just whatever, but die of a stress-related problem.
Wow.
Typically cardiovascular, right? So like what protected them was the belief that stress is good for you, right? And that means that one of the leading causes of death, at least in the United States, is a belief, the belief that stress is bad for you, right?
Wow.
That was what separated people in their terms of their response. We see the same thing to some extent in traumatic disorders, post-traumatic stress responses, right? What protects people who go through the same thing from post-traumatic stress disorder versus people who get it? It's also a belief, right, or a conception of what is happening.